Welcome back to DC Wrap. I'm Pat Poletti with WisPolitics.com, and joining me today is former Wisconsin congressman, ambassador to Tanzania, and administrator of the U.S. Agency for International Development, Mark Green. Ambassador, thank you so much for taking the time to join me.
It's great to be with you.
So on top of all of those job titles, we reported a couple months ago that you have a new one as well, Executive Director of the DC-based McCain Institute for International Leadership. What have you been working on since you took that role in April?
Well, so the McCain Institute is, as its title suggests, dedicated to advancing leadership. And in particular, we talk about character-driven leadership. So leadership that focuses on some of the principles that are associated with John McCain, the McCain family, and looking for ways to talk about those principles, but also develop the next generation of leaders here in Washington, D.C., around America, and more around the world, although that's getting a bit challenging, not being able to visit some of the places I would normally do. But just like the late senator, we believe fundamentally in American leadership, American values and principles, and whatever we can do to extend that leadership, that's very much our mission.
So prior to taking over at the McCain Institute, you spent nearly 3 years at USAID, departing the agency earlier this year while we here in the United States were in the early stages of responding to the COVID-19 pandemic. That wasn't necessarily the case globally, though, with obviously some countries being hit by the coronavirus much earlier than we were. Could you shed a little bit of light on that agency's efforts to fight against the pandemic on the more global stage?
Sure. So first off, the good news is that it could have been much worse. In so many ways, the investments that the American people and USAID have made over the years in key health systems, public health systems, testing and monitoring, capacity building, training doctors and nurses was enormously helpful in those early weeks of the COVID-19 pandemic. And so that was very, very helpful. But there's obviously a ton of work to be done. You know, it's a public health challenge, very obviously. It's much more than that. I worry very much that the challenges caused by COVID are going to impact the global economy, the economic fortunes and futures of so many parts of the world. And also, sadly, I think if we're not careful, undo some of the remarkable progress that's been made in fighting diseases like polio, measles, malaria, AIDS, tuberculosis. And so it is a trying time for those of us who are engaged in public health and international development.
And now to kind of tie those two things we just talked about together, kind of seeing countries respond to the pandemic by probably rightly looking internally, in some cases moving to seal off their borders and prioritizing the health and safety of their own citizens. But the world will, at some point, knock on wood, emerge from the other side of this public health crisis. What will international leadership in the post-COVID world look like?
Well, first off, something that's very important that you touched upon in your question, we have to care about what goes on around the world. And I think that's one of the lessons that we Americans easily forget. You know, I was elected to Congress in 1998. Tammy Baldwin, Paul Ryan, both in my congressional class and remain good friends. But not so long after we entered Congress, of course, came 9/11. And if you would have told me in 1999 and 2000 that we would see such a devastating blow against the United States from one of the most remote corners of the world, I would have said you were crazy. But one of the lessons about 9/11 is that we have to understand the world better, and we have to care about what goes on in those remote regions. And it's just as true with COVID-19. We have to care about the challenges facing communities around the world. We have to care about the investments that are made in global health, and we have to care about the caliber of leadership in many of these countries. Getting at your question, I think the real importance here is we have to have leadership that is clear-eyed, fact-facing, dynamic, and is able to convey messages to citizens on what they can do to avoid a disease like COVID, or what they do when they are infected with COVID. I think that's terrifically important. So you have to be able to communicate, and you have to have the trust and the support of your citizens to be able to build a countrywide, a community-wide response that can help the world take on this challenge.
Ambassador, we try and keep these short and sweet, so that's going to wrap up my line of questioning, but I always leave a little bit of time at the end here for my guests to talk about whatever really is on their mind. What's been pressing you recently?
Well, first off, I miss Wisconsin. I haven't been back since Christmas, hoping to go back soon. Wisconsin, Green Bay will always be home. I am delighted to see my friend Tommy Thompson in his position at the UW system. Of course, I'm a proud alum myself, but Wisconsin is always home, and I'm proud of my ties and my roots that are there. And I've always tried to bring those values with me to the work that I do, whether it be serving as ambassador in Tanzania. I was sworn in on a farm in Wisconsin, by the way, or in the work that I did at USAID. When the values of the people of Wisconsin are brought to bear, good things happen.
Ambassador, thank you so much for taking the time to join me.
It's great to be with you.